ICD is the WHO, and the latest ICD coming is ICD 11. But these were done according to ICD classification. The disorders of adult personality and behavior. We have various types of disorders. The first one is called specific personality disorders. The F61 is mixed and other personality disorders. F62 is enduring personality changes not attributable to brain damage and disease. F63, habit and impulse disorders. F64, gender identity disorders. F65, disorders of sexual preference. F66, psychological and behavioral disorders associated with sexual development and orientation. F68, other disorders of adult personality and behavior. F69 is the unspecified disorder of adult personality and behavior. So they are up from F60 to F69. Now, F60, the specific personality disorders, we have paranoid personality disorder, F60.1, schizoid personality disorder, 60.2, dissocial personality disorder, 60.3, emotionally unstable personality disorder, 60.4, histrionic personality disorder, 60.5, anarchistic personality disorder, 60.6, anxious or avoidant personality disorder, 60.7, dependent personality disorder, 60.8, other specific personality disorders, 60.9, personality disorder unspecified. Specific personality disorders are severe disturbances in the personality and behavioral tendencies of the individual, not directly resulting from disease, damage, or other insults to the brain, or from another psychiatric disorder, usually involving several areas of the personality, nearly always associated with considerable personal distress, nearly always associated with considerable personal distress and social disruption, usually manifests since childhood or adolescence and continuing throughout adulthood, usually up to the age of 40. These specific personality disorders is persistent and appears already within the late childhood and adolescence, being fully manifested in adulthood. Diagnosing after the age of 16 to 17 years. The disorder is usually associated with significant problems in occupational and social performance. People with this kind of thing cannot hold to their jobs and cannot really live with people. Causes of personality disorders are mostly genetic, though the influence of upbringing and parent-child relationship and social environment play also their roles. The paranoid personality disorder are characterized by excessive sensitiveness to setbacks, persistent refusal to forgive insults and slights, suspiciousness, tendencies to misconstrue the neutral or friendly actions of others as hostile or contemptuous, suspiciousness concerning fidelity of sexual partner, tendencies to experience excessive self-importance and preoccupation with unsubstantiated conspiratorial explanations of events. The personality disorder types can be expansive paranoid, fanatic, querulent, paranoid, sensitive, paranoid. Schizoid personality disorder 60.1 are schizoid personality disorder. Few activities provide pleasure to these people. Few activities provide pleasure. Nothing makes them happy. Emotionally cold, limited capacity to express either warm or hostile feelings with indifference to either praise or criticism. They have little interest in having sexual experiences with another person. Preference for solitary activities is what they go through. Excessive preoccupation with fantasy and introspection, and lack of close friends, and marked insensitivity to prevailing social norms and conventions. The social personality disorder, that is 60.2, are gross disparity between behavior, a callous disregard for the feelings of others, incapacity to maintain enduring relationships, gross attitude of responsibility, very low tolerance to frustration, low threshold for discharge of aggression and violence, that they've got short fuse, incapacity to experience guilt and to profit from experience, including punishment. They have a tendency to blame others or to offer plausible rationalizations for the behavior, bringing the patient into conflict with society. These type of personality disorders can be immoral, antisocial, asocial, psychopathic, and sociopathic. Emotionally unstable personality disorder 60.3. Emotionally unstable personality disorder are characterized by a definite tendency to act impulsively without consideration of the consequences, without caring what will happen, together with their affective instability. They have outbursts of anger that may lead to violence, particularly in response to criticisms. That is the impulsive type. Two types may be distinguished. Impulsive type, characterized predominantly by emotional instability and lack of impulse control. Borderline type, characterized in addition by disturbances in self-image, aims, and internal preferences, by chronic feelings of emptiness, by intense and unstable interpersonal relationship, and by a tendency to self-destructive behavior, including suicide gestures and attempts. The types of these personality disorders are aggressive, borderline, and explosive. This is the best personality disorder we've seen. Yes. Histrionic personality disorder. Histrionic personality disorders are people with self-dramatization, people who have what pseudologia fantastica or falsehood. They tell lies. They utter wrong things to please them. They have exaggerated expression of emotions. They have enhanced suggestibility. You suggest to them, they do. They are shallow and labile affectively. Continual seeking for excitement. They look for things to make them happy. Appreciation by others and activities. They look for appreciation by others and activities in which the patient is the center of attention. Over concern with physical attractiveness together with inappropriate seductiveness. They are egocentric, manipulative, or rather they develop manipulative behavior. The types that we have are hysterical and psycho-infantile. Then we have the anarchistic personality disorder, characterized by feelings of excessive doubts, preoccupation with details, perfectionism interfering with task completion, excessive contentiousness and pedantry and rigidity, intrusion of insistent and unwelcome thoughts or impulses that do not attain the severity of an obsessive compulsive disorder. The types that we have are compulsive, obsessional, or obsessive compulsive personality disorder. Anxious and avoidant personality disorder are characterized by persistent and pervasive feelings of tension and an apprehension, preoccupation with being criticized or rejected by others, avoidance of social or occupational activities because of fears of disapproval or rejection. And the dependent personality disorder are characterized by pervasive, passive reliance on other people to make one's major and minor life decisions. They can't decide on their own. Great fear of abandonment, feelings of helplessness and incompetence, passive compliance with the wishes of elders and others, and a weak response to the demands of daily life. Lack of vigor may show itself in the intellectual or emotional spheres. there is often a tendency to transfer responsibility to others. And this type of personality disorders are asthenic, inadequate, passive, or self-defeating. Enduring personality changes are not attributable to brain damage and disease. Changes, these are enduring personality change after a catastrophic experience. After a catastrophic experience, like in PTSD, enduring personality change after some psychiatric illness, or other enduring personality changes, or enduring personality change unspecified. Enduring personality change after catastrophic experience usually present for at least 2 years following exposure to catastrophic stress, characterized by a hostile or distrustful attitude towards the world, social withdrawal, feelings of emptiness or hopelessness, or chronic feeling of being on edge, as if constantly threatened, and estrangement. Enduring personality change after psychiatric illness, mostly schizophrenia, may appear due to the traumatic experience of suffering from the severe psychiatric illness. And personality changes after concentration camp experiences, personality change after disasters, personality change after prolonged captivity with imminent possibility of being killed, like we're being kept under uh, hostility or being taken nearer. Exposure to life-threatening situations, such as being a victim of terrorism, and another one, personality change after a torture. Treatment of personality disorders, not easy, but psychotherapy may offer a chance. Psychotherapy, people who complain about lack of confidence and have difficulties in making relationships are usually motivated for psychotherapy. In emotionally unstable and dissocial personality disorders, the patient should recognize the situations which provoke his or her pathological reactions and should manage to avoid them. Psychotherapy of personality disorders is a very difficult task, and to reach a partial effect requires patient thorough motivation. Pharmacotherapy helps in emotional disorders. Use of anxiolytics and SSRIs, antidepressants, suppress anxiety and depressive symptoms. Lithium and other thymoprophylactics like carbamazepine, valproic acid reduces mood fluctuations and aggressive tendencies. Habit and impulse disorders, F63, habit and impulse disorders. We have one, pathological gambling. There is 60.3.1, pathological fire setting, pyromania. 63.2, pathological stealing, kleptomania. 63.3, trichotillomania, that's pulling of the hair, trichotillomania. 63.8, Other habit and impulse disorders that may be there, and 53.9 habit and impulse disorder unspecified. Pathological gambling, it's common, consists of frequent repeating episodes of gambling which dominate patients' life, leading to social, occupational, material, and family detriment. It means an intense to urge to gamble and preoccupation with ideas of the act of gambling, which finally leads to large debts, criminal acting, loss of job and family. Psychotherapy and regime therapy is alike the treatment of alcoholism group. Psychotherapy, we call anonymous gamblers. 12-step psychotherapy, family therapy, etc. are used. Pathological fire setting, pyromania, like it's happening in our schools now, characterized by attempts at and at acts of setting fire to property or objects without any apparent motive, connected with an intense interest in watching fires burn and feelings of increasing tension before the act and intense excitement immediately after it has been carried out. Sometimes they use it to masturbate. Kleptomania, the pathological stealing, means that the patient suffers from an intense impulses to steal objects that are not acquired for personal use or monetary gain. This disturbance may appear within the symptomatology of eating disorders. And trichotillomania is characterized by noticeable hair loss due to recurrent failure to resist impulses to pull out hairs. Gender identity disorders, to have one transsexualism, dual role transvestism, 54.2 gender identity disorders of childhood, 64.8 other gender identity disorders, 64.9 gender identity disorders unspecified. And disorders of sexual preference, that is disorders of sexual preference, fetishism or fetishistic transvestism, exhibitionism, voyeurism, pedophilia, sadomasochism, multiple disorders of sexual preference, other disorders of sexual preference, disorders of sexual preference unspecified, and psychological and behavioral disorders associated with sexual development and orientation. We have sexual maturation disorder, ego-dystonic sexual orientation, sexual relationship disorder, other psychosexual development disorders, psychosexual development disorder unspecified, and other disorders of adult personality and behavior. We have elaboration of physical symptoms for psychological reasons, intentional production of feigning of symptoms or disabilities, either physical or psychological, called factitious disorder. Other specified disorders of adult personality and behavior, and unspecified disorder of adult personality and behavior. The law and ordinary psychiatric practice. Consent to medical treatment and to hospitalization. The patient should be informed about the treatment procedures and probable side effects of them to be able to give informed consent. And compulsory admissions and treatment. Admissions without consent is realized in emergency situations where there is suicide attempts, aggressive behavior due to mental disorder towards other people, disorders of behavior endangering patient's life. A compulsory admission should be reported to the local court within 24 hours, and the court will decide within 1 week's period whether the admission has been justified. Now, there is one we're going to learn in forensic psychiatry called testamentary capacity. Testamentary capacity means the individual is able to make a valid will if there are some doubts about it. The validity of the testament can be challenged. The testator is the person should be of sound disposing mind at the time of making it. And 4 legal criteria. Number 1, the testator understands what a will is and what its consequences are. He knows the nature and the extent of his property. He knows the names of close relatives and can assess their claims to his property. He is free from abnormal state of mind. And he has serious and persistent mental disorders cause incapacity of making decisions. That is, the court appoints a guardian who is looking after patient of it. This thing is going out of the line. Hello.
Yes, doctor.
Yeah, I think the notes we have shared with you, I like them because that is our ICD, and they are completely different from the way DSM approaches personality disorders. And this one is it's nice to have and to keep because it will keep you. I will send the notes to your class rep and to share with you. Okay.
Okay, doctor.
Thank you. Are there questions? Why did it move to the... Bye.
Doc, there's just one question.
Mm.
Which should we use, ICD or DSM?
Both.
Okay.
If you use this one and in front of me, I'll give you distinction.
Okay, doc.
Thank you.
Thank you.
We are ICD. If you go to Ministry of Health, you'll find that all our reports are written appending ICD types. So it's okay now that it has been a DSM, and so people have forgotten about our own. Our own is ICD. And I like the ICD approach to personality disorder compared to the DSM. Okay.
Okay, doctor. Thank you. Thank you.
Recording stopped.